Hi, everyone. Thank you so much for joining us today. My name is Dr. Cian McCarthy. I'm a cardiovascular disease fellow at the Massachusetts General Hospital. Today, we'll be previewing and discussing an exciting virtual conference going back to the heart of cardiology 2021, which will take place between December 6th and December 10th. I'm honored to be joined today by two faculty members who will share some more information about the topics that will be covered at the meeting and answer some of your questions. So I would like to welcome Dr. Fatima Rodriguez, an assistant professor of cardiovascular disease at Stanford University, and Dr. Martha Galati, president-elect of the American Society of Preventive Cardiology. Thank you both for joining us today. I think there are many special aspects to this conference, and I think it's just a perfect way to round out the year and recap on all the major developments that have happened in cardiology this past year. As we wait for some questions for the audience, why don't I open up with a few questions for you both? So, Dr. Rodriguez, you'll be moderating the conference along with Dr. Michael Gibson. What can attendees look forward to from this year's conference?
Thank you. I'm very excited to co-moderate this year's Heart of Cardiology. I was part of the co-moderator last year for sessions focused specifically on COVID-19. And this year, COVID-19 will still be part of some of the presentations, but it's not the theme of the topic. We have presentations really delivered by world experts on multiple topics. And again, the benefit of these virtual meetings is that you don't have to pick, and there's 6 live stream sessions. I'm particularly looking forward to the sessions on lipid management and cardiometabolic disease because these are my clinical and research areas. And I know Dr. Gulati will be leading one of these sessions as well.
That's awesome. Yeah, I think they're definitely very exciting areas. And I think one of the beauties of the conference is that all the content is available online for several months after the conference. So if you can't make a particular session that you're interested in, the content will still be available for a long time after, which is great. And the timing of the conference, I think, is on in the evenings in Eastern time as well, which is convenient to the busy working clinician also. So Dr. Galati, Dr. Rodriguez mentioned the session on cardiometabolic disease, and that will take place on Thursday, December the 9th, and you'll be co-chairing the session and also giving a talk on how these conditions relate to women and minorities. Can you give us a sneak preview of what you'll be discussing in that session?
Yeah, sure. So, I'm going to be speaking on both how sex and race impact cardiovascular health, which I think we all know that women and as well as people from diverse backgrounds have been underrepresented in a lot of our research. And it should be no surprise that they have poorer outcomes as a result of this. But we need to know where the gaps are. And so I'll be talking a little bit about the gaps in both of these populations. And I think, you know, when we know that risk factors are more prevalent, for example, based on certain races, you'd think that we'd actually focus more on them, but in fact, the disparities in the prevention arm of that is actually worse in those particular diverse backgrounds. So I think we have a lot to do, and I just want to highlight these things so that hopefully we can know where the gaps are and start making changes.
Yeah, that's a great point. Yeah, I definitely think these therapies, while the evidence shows they're very exciting and very impactful, it's getting them out to the communities that need them as well will be so important. Another session I'm really looking forward to as well is the session on Friday, which will cover precision medicine and treatment of maybe less common conditions. And there really have been a lot of exciting therapies in this area for conditions we previously had maybe very little or even no treatments for. What topics are you both looking forward to from that final session on Friday?
Yes, that's a really exciting session on Friday. And although these are rare diseases, some of them are not that rare. They're just underdiagnosed. And I think we have an exciting session on hypertrophic cardiomyopathy and the treatments for this, that again, using novel approaches, including gene-based therapies. But then others like cardiac amyloid, again, are more prevalent. A condition that I deal with in clinical practice often is familiar hypercholesterolemia. Again, more prevalent than perhaps we think, and it's underdiagnosed. But some of the novel therapies around precision health in these topics can really also be generalized to more common diseases. So I'm excited to hear about the practice changing science, some of the new therapies in the pipeline, and importantly, as Dr. Gulati said, really, how do we get these treatments to all the populations that are affected, and with this particular emphasis on narrowing any disparities and gaps in diagnosis and treatment.
Hmm.
Yeah, I agree with that. I think that, all those diseases, I was going to say the same thing. They're not as rare as sometimes we assume. I think one that's going to be exciting is about sarcoid because it is the great masquerader, as I think the title of that talk is. And I think, having more information about how to diagnose it and now how to treat it. I also think pulmonary hypertension, again, something that, we it really isn't rare. I mean, we see it a lot, but a lot of us are not that skilled at treating it. Unfortunately, if you're in a tertiary center, you have the luxury of having other people to help you manage that disease. But in reality, in the community, I think people really do need assistance in this particular group that we know is such a high risk group. And I know it's not in the rare disease talk. I think it's in the heart failure talks, but I think one of the talks I was very much excited by was Dr. Kittleson's talk on making essential treatment choices in heart failure because it applies to more than heart failure too. I think her discussion will be quite, relevant to, when we have new medications, how do we use them and who gets them and even the cost of therapies as well, and even how many therapies can you have?
Yeah, they're all great points. It's interesting that you highlighted sarcoid and pulmonary hypertension because I totally agree. I think cardiac amyloid is getting increasing more attention in the cardiovascular community, which is great, and we definitely need to be aware of that. But sarcoidosis and its relation to cardiovascular disease, not so much. And I think definitely, as you said, it's a great masquerader, and so that certainly will be an interesting session, I feel. Um, Now, another session that's very exciting as well, and I know Dr. Rodriguez, you already mentioned it, will be the session on lipid lowering. And this session or this area of cardiology is also one that is evolving, in particular looking at therapies beyond just LDL. What can the attendees expect to learn from that session, or what are you looking forward to in that area, especially given your clinical interest in that area?
Yeah, so this is something I spend a lot of time thinking about. Again, we know that statins are the cornerstone for treatment and prevention of cardiovascular disease, but there are a lot of therapies in the pipeline, and some of those therapies are now available to patients. So we need to engage our cardiovascular community in when to choose those alternative strategies that may come with an added cost. There are also some innovations and some exciting talks around primary prevention and triglyceride lowering therapies. And we also have a discussion about antithrombotic therapies. So again, the landscape in lipid lowering and cardiovascular prevention is growing. And like heart failure, a lot of times clinicians have to decide, okay, which things do I prioritize in what order and for which patients. So I think we're going to get a lot of insights on that from this session.
And I think it's also interesting, we learned a lot from PCSK9 inhibitors, in how it got rolled out and how underused what we thought was a breakthrough medication that we would all have to use. And I think these new drugs that are coming on the market now, I think that they've learned lessons as well about how do we need to move forward with new therapies as well. Are we going to make it a big burden for physicians to be able to access them for their
Mhm.
patients, or what will
Mhm.
be the problems with them, or what will be the solutions, actually, I think is what I hope to hear from other people.
Yes, I agree. And I think the implementation of these therapies is just as important as the discovery and the rollout from the clinical trials. So I look forward. I think the physicians and scientists that we have speaking do a lot of this and will give us some tips and best practices.
That's a great point. There's definitely been a lot more interest of late in implementation. I think we've all realized as a community that we have the data now on a lot of these agents across different subspecialties of cardiology. We could be doing a better job, and we saw some data for that at AHA, in particular in the area of heart failure, and also in prevention as well. And the heart failure section is also a very exciting area. There's always, every year, there's a new exciting trial in heart failure. And I think, the heart failure with preserved ejection fraction this year in particular will be an area of interest.
Yeah, I think Dr. Butler's talk will be really relevant to that specific area. And I think everyone will be excited to hear from him, break it down, from the big trials, but be able to break it down into practicality and sort of combine some of the studies we've seen just recently.
Mm-hmm, mm-hmm.
And I mentioned that last year we had a lot of focus on COVID-19. So don't worry, for those of you that are still excited and looking for COVID-19, we do have that interspersed with all the sessions, because there are some noteworthy findings between how therapies interact with COVID-19, not only as an illness, but also in terms of how we treatment and management. So I think we'll hear a little bit about that in the heart failure session. There's a great talk about that. How do we treat heart failure in the COVID era, and what lessons have we learned? And we have learned a lot of valuable lessons.
And additionally, I think anytime anyone's presenting new trial results, they're always talking about how COVID, disrupted the normal, how these studies had to change and change quickly, and how it affected enrollment or how they followed up patients. So depending on which session you're in, or if you go to them, you'll hear this. I mean, because COVID affected how we did research as well.
Mm-hmm. And the final session that really caught my eye is the one on device-based cardiovascular care. I just thought this session, really, there is something for everyone in here. We have structural cardiology, we have renal denervation, blood pressure control, AFib screening. Which talk in that session caught your eye, or are you looking forward to?
I am looking forward to Dr. Curtain's talk on renal denervation, because I do think we need to know, how that practically should be implemented for patients, and how does it affect all our patients with hypertension, particularly uncontrolled hypertension.
I'm looking forward to Dr. Chirakia's talk. He's a colleague of mine at Stanford, on remote patient monitoring for atrial fibrillation, and really capturing the atrial fibrillation burden. We have patients come to us all the time in clinical practice saying, my device caught atrial fibrillation. What's the burden? What's the best thing to do now? So I think that will be an insightful talk. And again, also, as Dr. Gulati mentioned, how we do studies, because we've been able to do studies around atrial fibrillation that have been almost entirely remote. And again, that is an opportunity to innovate in how we conduct clinical trials.
Certainly, certainly. Well, I think that's probably all we have time for today. I'd like to thank you both for joining us today. We hope to see everyone next week. This is not a conference you want to miss. There's so much in store, including engaging presentations, lively faculty discussion, and even interactive activities such as the Med Challenge and mural painting. So if you haven't registered yet, you can do so now at the link in the description of this event. Thanks so much for joining us today, and take care, everyone.